Welcome to the deep dive. Today, we're digging into something pretty fascinating in veterinary medicine.
We are. It's about how cancer can cause problems, way beyond the actual tumor site.
Exactly. We're using a text on veterinary paraneoplastic syndromes as our guide for this exploration.
Right. And our goal is pretty straightforward. Unpack what this source tells us about these syndromes, what they are, how pets show them, and the really interesting part, why they even happen, strictly sticking to this text.
And the thing that really grabs you, I think, is how these signs pop up in places you wouldn't expect, like totally unrelated to where the cancer actually is.
Yeah, it's often quite surprising. A lung tumor causing leg changes or a pancreatic issue leading to hair loss. It's like the cancer's sending out these remote signals causing trouble elsewhere.
Okay, so let's jump right in. What exactly are these paraneoplastic syndromes? PNS, the source calls them.
Well, the text defines them as a pretty diverse group of systemic disorders.
Systemic meaning affecting the whole body.
Essentially, yes. The core idea from the source is that they stem from the metabolic effects of the cancer. But crucially, not because the cancer cells have spread to that distant location.
Ah, so that's the paraneoplastic bit. Para meaning beside or beyond the tumor.
Precisely. The source really stresses that these effects are happening in tissues remote from where the actual tumor is growing. The cancer's presence here causes a problem over there.
Okay, that covers the what. Now, the big question, how?
Yeah.
How does a tumor in one place manage to cause chaos somewhere else entirely? What does the source say about the mechanisms?
The main mechanism explained in the text is that the tumor itself starts producing and releasing substances.
Okay.
These could be things that type of cell normally never makes, or maybe it's a normal substance, but it's being pumped out in, huge excessive amounts.
So the tumor's acting like a rogue factory, secreting hormones or other factors it shouldn't be?
That's a good way to put it. But the source also lists other potential causes. It's not just the tumor secretions.
Right. What
It mentions things like stimulating the body's own immune system to attack normal tissue, so autoimmune reactions, or the formation of these things called immune complexes that can cause issues.
And didn't it also mention immune suppression?
Yes, that's in there too. General immunosuppression is another possible etiology. And interestingly, it talks about the tumor causing cells far away to produce receptors they shouldn't have, or even blocking normal hormones from doing their job.
And it wasn't always the tumor cells themselves making these substances, was it? I recall something about normal cells reacting.
That's a really important point from the text, yeah. Sometimes it's the body's normal cells reacting to the tumor.
How does that work?
The example given is tumor necrosis factor, or TNF. The source suggests that normal cells, like reticuloendothelial cells, might produce TNF in response to the tumor's presence, and that TNF is thought to play a role in cachexia, that severe weight loss and muscle wasting we often see with cancer.
Okay, so there are several potential pathways. Hormones, immune responses, normal cells reacting. But then the source kind of throws a curveball, doesn't it?
It does. After laying out these possibilities, the text is very upfront that for many of these paraneoplastic syndromes, the exact cause, the etiology, it's still unknown.
Really? So we see the effect, but we don't always know precisely how the tumor is causing it.
Exactly. We have some pieces of the puzzle for some syndromes, but for many others, there's still a lot of mystery.
Okay, so moving on. Who gets these syndromes? And what kind of signs are we talking about? It sounds like it could be almost anything.
According to the source, pretty much any dog or cat with a malignant cancer could potentially develop one. That's the most common scenario. It does say, though, that rarely, even a benign tumor might trigger one.
And the signs themselves.
Incredibly varied. They really depend on the specific type of tumor and which organ systems are being affected remotely. The source provides a pretty long list to show the range.
Give us a few examples.
Okay, so you might see things like alopecia, that's hair loss, or cachexia, the severe wasting we mentioned. Hypercalcemia is a big one, high blood calcium. Or the opposite, hypoglycemia, low blood sugar. Then there are really striking things like hypertrophic osteopathy, weird bone growth on the limbs, or skin conditions like superficial necrolytic dermatitis.
Wow.
Even blood clotting problems like thrombocytopenia, which is a low platelet count. It's a huge spectrum.
It really drives home that these strange signs could be the very first thing someone notices, and they seem totally disconnected from a tumor that might be hidden somewhere.
Absolutely.
So if a vet suspects one of these syndromes based on these unusual signs, how does the source say they go about diagnosing it?
Well, the first step is really ruling out other things. The differential diagnosis, the list of possibilities changes depending on the specific syndrome you're looking at.
Makes sense.
Yeah.
And I assume basic blood work and urine tests are usually involved early on.
Yes. The text mentions that your standard CBC, biochemistry panel, and urinalysis are often helpful. They can pick up some of the systemic changes, electrolyte weirdness, abnormal blood cell counts, maybe signs of organ trouble, and help monitor things.
Are there more specific tests mentioned for certain syndromes?
Definitely. The source uses hypercalcemia as a prime example. For that, you'd specifically measure ionized calcium and parathyroid hormone, PTH.
Okay.
And the text notes that typically with hypercalcemia caused by cancer, you see high ionized calcium but low PTH. And often you'll find elevated levels of something called PTH-RP,
PTHR.
parathyroid hormone-related protein. It acts like PTH, but it's coming from the tumor or because of the tumor. Measuring that can be a key diagnostic step.
What about imaging? X-rays, CT scans.
Crucial. Often, the goal of imaging is to find the hidden tumor that's causing the whole problem. The source specifically mentions using radiography, like X-rays, for hypertrophic osteopathy because you can actually see the characteristic new bone growth on the limb bones.
Right.
And then more advanced imaging, like CT or MRI, is often necessary to find what the source calls an occult tumor, one that's hidden and not obvious from a physical exam or basic X-ray.
And for those skin signs you mentioned.
For the paraneoplastic skin conditions, the source says a skin biopsy is the way to go for diagnosis.
Okay, so you've done the detective work, figured out the syndrome, maybe found the underlying tumor. What does the source say about treatment? How do you tackle these?
This is maybe the most critical point from the text, and maybe a bit counterintuitive if you're just thinking about the symptoms you see. The definitive treatment, according to the source, is to treat the underlying neoplasia.
So go after the cancer itself.
Exactly. Get rid of the tumor or control it, and that's the best way to make the paraneoplastic signs go away.
You don't just say give medication specifically for the high calcium or the skin rash and ignore the tumor.
Well, you might manage those signs to help the patient feel better, absolutely. But the source is clear that for a real fix, you have to address the root cause, the cancer. Specific treatments for the signs are often more about support.
And what if treating the tumor isn't really an option or doesn't work?
Then, the source indicates, the focus shifts purely to managing the clinical signs. But it's palliative care at that point aimed at comfort and quality of life, not curing the syndrome itself.
Got it. And any specific medications mentioned?
The text states that medications really depend on the specific tumor type and the particular syndrome being manifested. And monitoring the patient is basically the same protocol you'd follow for monitoring the underlying cancer itself.
Okay, this brings us to where the source gets really specific and, honestly, kind of amazing. It has this table linking specific tumors to specific syndromes. Let's pull out a few examples to really illustrate these weird connections.
Yeah, that table is fantastic for showing these remote effects in action. Let's start with feline paraneoplastic alopecia, hair loss in cats.
And the cause, according to the source, not what you'd probably guess.
Not at all. It links it to carcinomas of the pancreas and the biliary tree, the tubes draining the gallbladder.
Wow. A tumor deep in the abdomen makes a cat lose its fur, often in a very specific pattern.
Right. Symmetrical loss on the belly and limbs, often. And here's another fascinating detail the source points out. For this specific syndrome in cats, the mechanism is listed as unknown.
Unlike in dogs, where some hair loss can be linked to adrenal tumors making too much cortisol.
Exactly. The source contrasts it with that scenario in dogs, so it highlights, species differences and the fact that we just don't know the why for this particular cat syndrome yet. Another mystery.
Okay, what about hypertrophic osteopathy, HO? Those limb bone changes. That one seems particularly dramatic.
It really is dramatic. The source connects this to tumors in the chest, primary lung tumors, or cancer that has spread to the lungs, but also sometimes tumors within the abdomen.
So a tumor in the chest or belly leads to painful, swollen lower legs.
Yep. You see soft tissue swelling first, typically in the distal limbs, like down by the paws, and then radiography shows this characteristic periosteal new bone growth along the shafts of the long bones there. It's a striking remote effect.
So far from the actual tumor. Any idea how that happens?
Well, this is another one where the source emphasizes complexity and uncertainty. The etiology is officially listed as unknown. Again. But the text does list several potential mechanisms that researchers are looking into. Things involving the vagus nerve, weird reflexes, circulating cytokines or growth factors, maybe immune system involvement. even tiny blood clots in the limbs. Lots of theories, but nothing definitively proven according to this source.
Fascinating. Okay, let's talk about hypercalcemia, the high blood calcium. You said that's a common one.
Very common. And the source links it frequently to lymphoma and anal sac adenocarcinoma agasaka in dogs. For cats, it mentions lymphoma and squamous cell carcinoma as common culprits.
And is the mechanism clearer here?
Often, yes, especially in dogs. The source explains that for lymphoma and agasaka in dogs, it often involves the tumor cells producing and secreting that PTHRP we talked about earlier.
The hormone mimic.
Right. Parathyroid hormone-related protein. It tricks the body into raising calcium levels, so that's a pretty clear example of a specific tumor product causing a systemic metabolic problem. Although the source does note the mechanisms are less well understood in cats.
Okay, there was one you mentioned earlier, really specific to a breed and a type of tumor. Nodular dermatofibrosis.
Ah, yes, that's a very specific one. The source ties this tightly to kidney tumors, renal cystadenoma or cystadenocarcinoma, and it primarily affects German Shepherds and German Shepherd crosses.
Just that breed mainly.
Primarily, yes. And the source adds another layer. It's actually an inherited condition in these dogs, autosomal dominant. There's even a potential link mentioned to a specific gene, FLCN, on chromosome 5. So it's this really specific kidney-skin connection with a genetic basis in this breed.
That is specific. What about superficial necrolytic dermatitis? That sounds nasty and had multiple names.
It does sound nasty, and it looks pretty bad, too. The source lists its aliases: metabolic epidural necrosis, hepatocutaneous syndrome, necrolytic migratory erythema. Quite a mouthful.
And what's it linked to?
This one is associated with liver cancer, hepatic neoplasia, or sometimes pancreatic cancer, specifically a type called a glucagonoma. It can also be seen with just severe underlying liver disease, not necessarily cancer.
Okay, so liver or pancreas tumors causing skin problems. How?
Again, the source says the mechanism is unclear, but it sometimes occurs alongside glucose intolerance or even diabetes mellitus. So it's this complex interplay potentially involving the liver, the pancreas, skin metabolism, another puzzle.
It really shows how tangled these connections can be. Maybe just touch on one or two others briefly.
Sure. The table also mentions things like hyperviscosity syndrome. That's where the blood gets really thick and sludgy.
Yikes.
Yeah, often seen with cancers that produce huge amounts of antibodies like multiple myeloma or diencephalic syndrome linked to specific brain tumors near the hypothalamus, which strangely causes profound weight loss even though the animal might be eating well.
It's just incredible. These examples really hammer home this central point, don't they?
They absolutely do. Cancer isn't just a local problem. Its effects can, ripple out across the entire body in these complex and often really surprising ways through mechanisms we sometimes understand but often still don't.
So let's bring this back to you, our listener. Why is knowing about all this actually important? Why should you care about these weird syndromes?
Well, think about it. Recognizing that seemingly random sign, maybe unexplained hair loss or sudden lameness, or maybe your pet is losing weight despite eating normally, recognizing that might not just be an isolated issue.
Right. It could be a clue.
It could be the first clue, the critical piece of information that points towards an underlying cancer, maybe one that's hidden and would otherwise be missed, or diagnosed much later when it's harder to treat. It really underscores how interconnected the body is. A problem here can signal trouble way over there.
Absolutely. This deep dive really illuminates that cancer often acts as a systemic disease, sending out these signals that cause paraneoplastic syndromes far from the original tumor.
And maybe the final thought to leave you with, drawing straight from our source material. Think about how many of these syndromes still have an unknown mechanism.
Yeah, that came up again and again.
It did. What does that lingering mystery really tell us? It speaks volumes about the incredible complexity of how cancer cells interact with the host body, doesn't it? And it makes you wonder, what other subtle remote effects or hidden communication pathways between tumors and the rest of the body are still out there, just waiting to be discovered?